Hello and welcome to Unwind Sessions, where right after my shift I give the highlights of my workday and answer any questions that might have been asked at a previous session. My name is Juan. I am an English, Spanish, medical video remote consecutive interpreter with over 4 years of experience. Today is Wednesday, July 14, 2021. Today I took a total of 38 sessions. That's a little bit more than the usual 30 sessions that I take every day. However, this day was pretty easy. It was pretty uneventful. Nothing worth mentioning about interpretation today. It was a mix, like always, video sessions and phone sessions. It was very nice today because almost at the end of my shift, like I think the last 3 sessions were all audio. So that always gives me a little break, and I'm always grateful for that. And that was pretty much it. So today I'm just gonna get right into it. And the topic of this video today is going to be 10 must-know medical professions for medical interpreters. And more than actually just knowing this top 10 medical professions, I would say that you should be learning the vocabulary that goes along with these professions. Like, for example, of the tools that they use, the diseases that they diagnose, and all of that. That is going to save your life. And this list is not in order of importance. It is just a list that I made with the top 10 professions that I know for sure that I am going to be taking those calls for these doctors or medical professionals in a week. Like, not a week is gonna go by that I have not taken one of these sessions. That's why I think that this is the top 10 must-know medical professions for medical interpreters. Also, in the future, in the following days and weeks, I am going to do lists like this, but focusing on the medical profession. For example, obstetrician and gynecology. I'll be doing the top 10 must-know vocabulary for this medical profession and things like that. And hopefully I can point you in the right direction so that as beginner interpreters, you have an idea of the sessions that you are going to be taking most. That way you can focus more on those that are actually going to help you, that you need to know, because you're gonna have one of these calls every week at least. And another thing that I want to mention is that well, let me just get right into it. But I'm gonna be giving you. This is not focused for a certain target language. I'm just going to mention everything in English right here, and I'm gonna give you definitions. I do plan to make, or actually, we as Interpret Your World, we plan to make a video to help you guys practice, and that, of course, because we're limited to English and Spanish, is only going to be for you to practice the English and Spanish vocabulary words. But for this one, I'm just going to leave everything in English. That way it's not only useful for Spanish interpreters, but also for interpreters of every language. So let's get right to it. The 10 must-know medical professions for medical interpreters. The following definitions are from sgu.edu. And the number one on the list here is obstetricians and gynecologists. The definition is that they provide medical care relating to the female reproductive system. These types of physicians diagnose and treat diseases and also provide care related to pregnancy and childbirth. Now, this is one of those professions that in a single day, I am guaranteed to get more than one call, more than one session. I bet you is going to be OBGYN, obstetrician, gynecologist, which in English, they never call it like that. I've never, in the 4 years that I've been an interpreter, I've never heard English-speaking medical provider say obstetrician gynecologist. They never say that. They say OBGYN. So I wrote it right here, and here it is: obstetrician gynecologist. But of course they abbreviate it in English to say OBGYN. So this has everything to do with the woman's health, and you are guaranteed to get more than one of those sessions every day. Number two, family doctor. Now this could also be known as a family doctor, general practitioner, PCP, primary care doctor, and they all mean the same thing. This is one of the most well-known of all different types of doctors. They diagnose, treat diseases and injuries within the general population. They are the first point of contact for patients in the healthcare system and may refer patients to specialists when needed. Of course, this is your go-to doctor. This is the PCP, the first doctor that some insurance plans make you see the PCP to give you a referral to other specialties. So you can see how important knowing the translation for a family doctor is, and all the different ways that they call a family doctor. And definitely this is one of those professions that I am going to get more than a single call in one day. Number three, pediatricians. Pediatricians are physicians who diagnose and treat a wide array of diseases and injuries in children, adolescents, and babies. Pediatricians practice preventive medicine and also diagnose common childhood diseases such as asthma, allergies, and croup. They may work as a primary care provider or narrow their scope of practice in a subspecialty. They also provide referrals to other specialties as needed. And yeah, definitely pediatricians are, I don't know, I couldn't surely say if I get a pediatrician call every day, but I'm going to say yes, or maybe every couple of days. And sometimes I get a bunch. Today I probably took about like 5 pediatrician calls today. So yeah, this is definitely a must know. And of course as well, because they're like the first point of contact. They're like the family doctor for little kids, right? Because sometimes, although a family doctor can be a pediatrician, pediatricians are more specialized, and the pediatricians will not see adults like a family doctor. And sometimes general practitioners will see babies or kids, or when a pediatrician is not available, but they prefer that a pediatrician is seen. And of course, since pediatricians have more knowledge in little kids, I believe they are going to be better for their care. So yes, definitely pediatricians is also like I know I said no, but definitely I would say yes, at least one pediatrician call a day. Psychiatrists is number 4 on the list. Psychiatrists are physicians who diagnose and treat mental, emotional, and behavioral disorders. They conduct medical, laboratory, and physiological tests to diagnose and treat patients. Now, psychiatrists, this is not one of those professions that I get a call every day with a psychiatrist. I'm sorry, and I haven't been showing you the list right here. Family doctor, pediatrician, and we are right here on the psychiatrist, right? So psychiatrist is not one of those calls that I get every day, but at least once a week there are psychiatrist sessions, or sessions that relate to psychiatry. So even though this is not like a session that you are going to be getting every day, it is good to get familiar with the terms that go into psychiatry, because for sure, you are going to get at least a couple of psychiatry sessions a week. And number 5, where is it? I'm not able to see. Number 5, cardiologist. I don't know if you can see that. There you go, cardiologist. And cardiologists focus on diagnosing, treating, and managing cardiovascular conditions, including hypertension and arrhythmias. While they are considered medical specialists, they can also focus their practice on interventional procedures. Now, again, cardiologist is not something that I see every day, but something related to cardiology, yes, definitely. There are referrals to cardiologists every day, that is for sure. And also, whenever you get a cardiology call, which you will probably get more than one a week, this is not surprising, since high blood pressure, heart disease, and I think coronary heart disease is like the #1 cause of death, like all over the world. So of course that makes sense. You are definitely going to get to see or have to assist a cardiologist with interpretation, or if not, a lot of the appointments that you are going to have to interpret are going to be related and using cardiology terminology. So definitely that is a must-know profession for medical interpreters, and not just the profession, but also the medical terms that go along with this profession. The medical vocabulary that go along with this profession. Number 6, radiologist. And radiologists are physicians who diagnose illnesses in patients through the use of x-rays, radioactive substances, sound waves in ultrasounds, or the body's natural magnetism in MRIs. Now, radiologists, definitely every day I do get a radiologist session. And well, it makes sense, right? Because we can't see through skin. So of course, doctors need all of the things mentioned: x-rays, radioactive substances, sound waves, ultrasounds, and MRIs. They need all of that to be able to properly diagnose a patient. So definitely, yes, a must-know profession, and also all of the terminology that goes with it, and this one is important because they send a lot of referrals to radiologists. But for sure, I always get at least every day one radiology session, and it could be any of the ones mentioned. And definitely, when they are doing the screening for the MRI, you are going to, the first time you ever get it, if you're not familiarized with the MRI screening questions, you are going to be sweating, my friend. You are going to be, you're gonna want to cry during that session, because those are going to be terminology heavy. But we have a video in our practice sessions that has you covered, and that is going to save your life with those MRI sessions, which are horrible the first time you experience them if you have no previous experience. So make sure to get on that. I don't remember what medical session it is, but yeah, definitely radiologist makes the list. Number 7, anesthesiologist. That one is that one right here, anesthesiologist. And anesthesiologists are physicians who administer anesthetics and sedation during medical and surgical procedures. They also maintain life support and airway management. Now, anesthesiologists help in surgeries. They want to keep the patients asleep, right? So they reduce the risk of injury doing procedures, and of course, imagine getting brain surgery and being awake. I think that'll be horrible, right? So they aid in that, and every day, definitely every day, I'll be getting a call for an anesthesiologist, and mm, well, you're probably thinking, well, what is an anesthesiologist going to interpret, right? The patient is sleeping. But before they do any procedure, the anesthesiologist has to speak to the patient, has to do his screening. So go ahead and get on that. If you have no idea what an anesthesiology screening is, go ahead and download some vocabulary. I don't think we have one. I don't remember if we have a practice session. I'm gonna look, and if we don't, I'm gonna be sure to make one soon. So definitely the screenings for the anesthesiologist have a lot, well, not a lot of vocabulary, but sometimes they do. It depends how extensive the questions are. But definitely go ahead and learn the anesthesiology screening. You could probably download something off the internet with all that information. So that was number 7. Number 8, physical therapist. And this definition is from BLS.gov, and it says physical therapists help injured or ill people improve movement and manage pain. They are often an important part of preventive care, rehabilitation, and treatment for patients with chronic conditions, illnesses, or injuries. Now, this is pretty much, for the most part, physical therapy sessions are going to be easy, because it's just going to be the patient that is going to be doing the exercises, right? So this, you should be familiar with what the physical therapist does and the exercises, and more than the exercises, because of course it's impossible to know all of the exercises. Well, not impossible, but there's a lot, because they cover the whole body, right? But what I would say is, like, focus on the movements. For example, curling, like curl your biceps, curl your legs, and things like that. Focus more like on the movements they would use to describe the exercises, because if you're not familiar with those terms, man, those are gonna make your life very difficult. And for some reason, like, those are things that you use every day. But me personally, whenever I heard curl, like, I knew what curl was, but I didn't know how to interpret it in Spanish, so that made it very hard. And then of course, bicep curls and all of those exercises, and sets, repetitions, all of those things that go with physical therapists. Go ahead and make sure that you learn all of that vocabulary, because it's going to make your life much easier, and you're going to be getting these calls all the time. Like I said, sometimes they're easy, sometimes they're hard, because it's an initial session and they're asking everything. So get on that. Number 9, occupational therapist. And this definition is from kidshealth.org. Occupational therapy, and this is actually the definition for occupational therapy. Occupational therapy is a branch of healthcare that helps people at all ages who have physical, sensory, or cognitive problems. OT can help them regain independence in all areas of their life. And I'm going to go ahead and step back into physical therapy, because physical therapists are also known as PTs. So whenever you hear PT, that means physical therapist or physical therapy, depending on the context. I'm pretty sure you will be able to differentiate from those. Now I'm going back to occupational therapist. Now occupational therapy is OT or occupational therapist. And definitely I do get a lot of occupational therapy calls as well. And you will do well in getting familiarized with the terminology that goes with occupational therapist sessions. They are very similar to physical therapists, but they're not the same. Like, for example, physical therapy is more focused on actually like getting you walking and performing all of the movements well, like really broad strokes and stuff. And occupational therapy is more focused in like you being able to comb your hair, like little fine little things that actually get you through your everyday life, right? Like for example, physical therapy is more about strengthening, like for example, like me, I have hunched shoulders, right? It's more focused on making sure that you actually have the strength to for your shoulders to be pulled back, and that you can actually have good range of motion and all of that, like you could move your arm and everything. And occupational therapy is more focused, for example, that you can reach a spoon to your mouth, right, to be able to eat, to comb your hair, to brush your teeth. So those are the differences. And of course, with occupational therapy, there are not really like all that exercises, like gym exercises, like occupational therapists, but there are like very specific words and things that they use, movements to describe and all of that. So be sure to learn that as well. And number 10, speech therapist. And speech therapist and assessment and the treatment of communicational problems and speech disorders. It is performed by speech language pathologists, SLPs. Now, I have never heard someone say an SLP is coming in, or we're gonna take you to ST or anything like that. It's just speech therapist. There's no abbreviation for that. And SPLs, which are often referred to as speech therapists. Now, this is not one of those sessions that you are going to be getting every day, probably every week, but definitely you have to learn the vocabulary for this, because there's a lot of technical vocabulary when they're using, like for example, the barium swallow, to make sure that a person can swallow correctly. And there's a lot of vocabulary that is very specific to speech therapy that I suggest you guys learn. And that is going to be pretty much it for me today. Those are the top 10 must-know medical professions for medical interpreters. And remember, the reason why I'm giving you this list is because I take the most calls from this medical professions. So don't just learn the names of the medical professions. Go ahead and actually dig into the most common terminology that goes into these professions. And like I said before, I am going to be working with lists from now on. Of course, I'm still going to be answering you guys' questions, so go ahead and ask any questions that you have. I am very glad to go ahead and research if I don't know the answer to it right away, and give you an awesome answer. That way we can learn together. So I hope you guys keep on asking those questions, right? But for the time being, I'm just going to keep on making lists unless there is another question, and I'm going to get more into depth into the vocabulary that you have to learn for these sessions or consults, I should say. So yeah, please leave your questions on the comments, and I will answer some of them on the next session. Remember that I'll be here every Monday through Friday after work. And also, if you don't know, we have a Patreon page where with as little as $1 of your support, you help motivate us, you help us to create more content, and we give you access to everything in that page. You get ad-free practice videos, the medical only ones. We still have to upload the rest of them, but for now, medical practice videos are ad-free. Scripts to all of the medical practice videos, answer sheets to all of the medical practice videos, vocabulary lists for medical interpreters, and much more content. And we are going to be adding much more content there in the future. That is going to be pretty much it for me today. I probably said that like 3 times today, but this is the last time I'm going to say it. Thank you so much for watching. Please like and subscribe if you have not done so for more content, right? And don't forget to share. Happy interpreting. Goodbye.